Hi there, Dr. Tansavatdi here. If you're watching this video, it's because you've had your facelift and you're now watching this for the postoperative instructions. You should have received a sheet at your preoperative appointment that outlines all the instructions that you need to follow after the surgery. So I'm going to just go ahead and highlight the main things so that you can kind of visualize every day from after the surgery what you have to do each day. So how I'm going to describe that is the first day, which is day 0, would be the day of your surgery, and then day 1 would be the following day. So day 0, your surgery, you've had the surgery. After the surgery, you're going home, and the first thing that you're going to be remembering to do is to resume taking your medications. Now, the first one is an antibiotic. You should have started one prior to surgery. After surgery, you're going to resume that antibiotic. Make sure to take it with food. The other thing that you should have gotten is a prescription for a narcotic. That's for pain control. And you can take one, but don't combine it with any other medications that can make you sleepy, because it can make you too sleepy, and that will be hard for you to wake up from after surgery. And also with the effects of anesthesia, it can combine to make it really bad for your breathing after surgery. So that's something that I would recommend, just taking one narcotic and not combining it with too many other pills. The other thing is that there should have been some vitamins that you started a few days before surgery. You're going to continue taking that after surgery when you come home. So that would be your arnica and your bromelain. And you want to take, again, the arnica, you can take that with food. The bromelain, you have to take that on an empty stomach. That's the only medication that you are going to take on an empty stomach. All right, so that's the first night. The other thing that you will have, just so that you probably with that dressing right now, but the dress, you're going to have a dressing after you leave the hospital or surgical center, and that wrap is important to keep a nice compression around the area that I've worked on. And that is because, you know, that when I do the surgery, I have to lift the skin away from the face and I put it back down. Now you can develop some fluid collection underneath that flap, so you need to keep that dressing nice and tight on you. Don't try to loosen it. I know there's a lot of concern sometimes. My patients will call and say, well, it's very constricting, especially men will say it's tight like a noose, like a tie that they're wearing for work. And you just have to you just have to put up with that for the next 24 hours until I see you the next day. It is important to keep that dressing on. All right, that is for your safety. Then day 1, you're going to come in for your postoperative appointment with me in the morning, or sometimes it's in the afternoon. Either way it may be, when you come in, we'll take that dressing off. And when you come in after that, I will fit you with a new chin strap, or if you have decided to use the AquaCool face mask, which is a cooling device that you're going to use for the next 3 days, then I'm going to fit you with that mask. It is important that if you're not using the mask, that you cool the area where we've worked on to decrease the swelling. So that would be using cold compresses, using a towel or washcloth that you've dumped into some cold water, and apply that on your face and neck. Now, it is much easier though to then go ahead with the AquaCool face mask, because with that system you have a mask that has water can flow right through this, and you're attaching it to a cooling system, and that runs at all times. So even when you're asleep at night and nobody can help you, you're constantly cooling the area that we've operated on. So that is day 1. So after I've taken off the dressing and put on this face mask or put on a chin sling, you're going to start cleaning the incisions. You're going to clean the incisions with half-strength hydrogen peroxide. You should have been given some Q-tips, or you should have them at home. You're going to dip the Q-tips in that hydrogen peroxide that's been diluted half and half with water. So you're going to dilute it, take that Q-tip, dip it in that half-strength hydrogen peroxide, and use it to clean the incisions around the ear. You don't need to do it in the hairline, because the hairline gets it's used to getting clots and stuff like that. You don't need to worry about that. You really need to just clean the incision that's very visible, which is around your ear. You're going to go around your ear with that Q-tip once or twice, and once you're done, go with a dry Q-tip. That's my tip, is to use a dry Q-tip to clean around. And then after you're done with that, use another Q-tip to apply new ointment, and that would be the bacitracin ointment to apply around your ear. Or you can use Neosporin too if you have that. Now you're going to do that 3 times a day, so don't forget that's morning, noontime, and then at nighttime. And that should coincide with all the medications that you've been prescribed. You should have been given an antibiotic, and that antibiotic is 3 times a day. It's also coinciding with your vitamins. So it should be pretty simple for you to remember. Morning, noontime, and then dinner time. Those should be the times that you should be doing the medications as well as the cleaning of the incision. All right, as simple as that, that's the first 3 days. So that's day 1, 2, 3, and then after that, you'll be returning to see me. Once the AquaCool machine is returned, you'll see me on that day 3, and at that time, I'm going to be fitting you with that chin sling. If, however, you had the chin sling from the very beginning, I won't see you at day 3, and just see me at 1 week appointment. So every day following that, make sure you're going to be cleaning the incisions and applying ointment. And that's pretty much it. Now when you get to day 3, when I've fitted you with this chin sling, you got to wear that chin sling 24 hours at all times. So I know it's hard for some people. They want to go out in public. It's okay if it's for a temporary point in time, if you're going to just do it for an hour or so, but you want to keep that chin sling on as much as possible. So we'll keep the outcome that you've had from surgery, the nice tight neck, we'll keep that extending for a long time if you do follow those instructions. Then at 1 week, when you come in for your appointment, we'll be removing those sutures. This is around the ears, and I'll also remove half of the staples. Sometimes I don't put in staples and I'll put sutures all around. If that's the case, I have to remove all the sutures at that 1 week appointment. So if I do remove the sutures and there's some staples, I do remove half the staples, and then that day, make sure if you're coming in for that appointment that you wash your hair before you come in, because the instructions will tell you not to wash your hair the day of after we've taken out the sutures or the staples. So if you want to wash your hair, wash before you come in for your appointment. All right, after those staples and sutures are out that 1 week, then you'll see me again in a couple more days, and that's to remove the remainder of the staples. So I don't take them all at once, because the very tightness of this facelift, what's holding it together are sometimes at the very crux of this incision, and that's where the staple is. So we want to keep that in as long as we can to hold everything in place, okay? So that is the majority of what I wanted to talk to you in these postoperative instructions. Some of the tips that I will provide you as well, in addition to what I've discussed already, is that you will not want to use a dryer during this time. Okay, because after you wash your hair, just leave it be, let it dry, air dry as you would, because you're not going to be going out anyways. Where are you going to be going? So one thing is, don't use a hair dryer, because the hair dryer at high heat is going to hurt, especially along the incisions where the staple is, or even if you don't, you're not going to have any sensation in the skin too. So one of the things that I worry about is if you use a hair dryer, you won't feel the heat, and you could actually cause a lot of heat damage to the skin itself, okay? The other thing that you should know is that you should be using a shampoo that is not strong. You don't want to use Head and Shoulders or something that has a lot of chemicals in it. So use a very light shampoo. One of the things that I recommend is usually Neutrogena or Johnson & Johnson. Those are great brands to use. Other people that have also recommended Dove, so that's another one that I would recommend. All right, the last tip that I have to recommend to you is walk early, walk often, and drink lots of water. Those are key, because you start forgetting to take care of yourself. You know, you've had all this done, you may look messy, you may look ugly, and you just don't want to go out, so you just don't do anything, and you just sit at home in your seat, prop your legs up, and in that case, you could be at risk of developing clots in your legs, and that traveling to your heart and causing some other complications. But more importantly, the walking is actually good for your body to heal. It will speed up the resolution of the swelling, and it'll actually make you feel better too. It should give you the energy that you need to recover from surgery. So that is important, to walk around the house, walk around your neighborhood, just kind of wear a hoodie or just go outside where people can't see you. Go to another neighborhood if you want to walk around. And then important to drink lots of fluids as well, because your body needs it. It needs water. We thrive on water. Actually, a majority of our body is consistent of water. So if you are recovering, you're trying to recover from surgery and want to heal at your fastest, please drink lots of water so that your body can really heal well. All right, that's it. Those were the key steps and the instructions for recovery after facelift surgery. If you have any questions and it's not answered in this video, sometimes I don't cover everything. These are just the majority, the main points. So if there's other things that are not covered in this video, that does not mean I didn't address them. You should go ahead and email us or call us or send a message through the app. We have our app, which is the Simplast Practice app, and if you log in, if we gave you those instructions ahead of time, log in, send us a message through that way, and that way I can answer your questions. Thank you for tuning in.